So welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today I'm joined by Ann Montgomery, and we're going to be talking about what matters to nursing home residents. So Ann is with Altarum, and I'll let you introduce yourself, and then we'll talk about this amazing special report that you guys released a couple of weeks ago.
Okay, well, thank you so much. I'm Ann Montgomery. I'm co-director of the Program to Improve Elder Care at Altarum, and delighted to be here. So thank you, Melissa. Thank you for doing what you do. So yes, Altarum is a pretty wonderful organization, nonprofit health services research organization, and the Program to Improve Elder Care is about all things older adults. So we look at nursing homes, we look at home and community-based services. We do lots and lots of things to try to improve the quality of care and the quality of life for people who are in the last decade or so of their lives. And nursing homes are a primary interest of ours. And we're doing some comprehensive culture change work. And we really believe that resident voices need to be lifted up in all respects. So one of the things that we've been thinking about lately is during COVID-19, which has really turned the nursing home world upside down, as well as all of society, of course. But, nursing home residents have been more isolated, we thought, than they ever have been. And part of the reason was that, there was an attempt to keep them safer. Since, as we know, nursing older people and nursing home residents in particular are particularly vulnerable to COVID-19. So 40% of the deaths that have occurred from COVID-19 are among residents of nursing homes and assisted living facilities. And that's really highly disproportionate because this population represents just 8% of total US cases. So it's quite a devastating impact. So the federal government, the Centers for Medicare and Medicaid Services, issued in mid-March a prohibition on visitation in nursing homes of family members, immediate relatives, and to keep people safer. And the result of that is something that we thought we ought to really look into. So we started to think about how we could look at the extent of social isolation and loneliness. And we decided that we should try to do a survey. Nursing home residents are not easy to survey, but we thought we could create a pretty simple, straightforward survey and put it out as a link, an online link, and then distribute it for two families, two administrators of nursing homes, two ombudsmen who are worried about nursing home residents being so isolated, and others. The two leading associations, the American Healthcare Association and Leading Age, were very helpful. Lots of people were really helpful. And so that's what we did. And we put together a survey and put it out in July, and we closed it at the end of August. And we heard from residents in 36 states. And I think that's a pretty good response. So that's what we decided to do. And I'm happy to talk about the results.
Yeah, so I was actually reading through part of your methods for doing that. And, and thinking about a convenient sample, but it is good to get the voice of any nursing home resident elevated, because I do think that they are the group that they weren't asked. Everything has been mandated by the federal government, and then left up to the states. And the podcast that's out this week is of my mom telling the story about finally being able to see my grandmother after 202 days. Right. And the devastation and the impact on my grandmother. So, and so many residents, that have a cognitive impairment don't have access to the computer. So, but I do think that the people that you heard from, it's a very powerful report, and we're definitely going to link it into my website as well. So maybe just start with what were some of the questions that you asked, and then kind of key things that stuck out to you the most.
Sure. Well, basically, I would say that the survey, which had 365 responses, looked mostly at social isolation and loneliness. And we really wanted to see kind of what the extent of visitation was, whether people went outside, whether they interacted with the community. and so on. We did also ask some questions about, basic quality of care and staffing and advanced care planning and bereavement. But mostly we asked people kind of before and after questions. What was it like before COVID-19? And what was it like during and post COVID-19, although still we're in the middle of it, really. So we heard from residents on a variety of fronts, and actually the most powerful responses came from the question that was open-ended, where people could really, in a narrative form, express exactly how they were feeling. And they were very clear that they needed something to live for. In other words, they felt reasonably safe as you can in these times, but they were devastated by the fact that they really couldn't, in many cases, leave their rooms. So some of the things that they said, I'll just repeat them because they're pretty powerful. One resident said, "I have depression. Why keep living? It's not living and it's barely existing." Another said, "I feel worthless and most days I feel like giving up, and I'm usually an upbeat, positive person. The facility needs to create a safe way for me to see my spouse and not keep me locked up in my tiny room. Hopefully I won't die from the way I'm now being treated." So really what we heard from residents was, concerned about, their own health, that's called failure to thrive, really. So you can lose your appetite. You can become so anxious that you really don't want to continue. Now, we heard a lot of that. We heard about their feelings of isolation within the nursing home. They aren't able to, in many cases, socialize with residents who are friends of theirs. We heard about people who weren't able to go outside and really missed that. They went outside usually several times a week often, and that was all of a sudden, not permitted. And they certainly did not go out into the community and, see their daughter or, visit for a meal or anything like that. So it was several different degrees of loneliness and isolation that occurred, really. And the entire picture, which was really a 6-month period, was basically, it resulted in severe harm.
Mm-hmm. Yeah, I mean, you think about it, there's not another population that, knowing that they have not been allowed to go outside, for 6 months. I find that, I think that's not humane treatment at all. And, the fact that nobody was at, it's just been, maybe it's been a blind spot. And I really appreciate the fact that your report is asking some of these questions. So what were some other things that because even my mom talked about the fact that, she's in a single room, not allowed to leave the room, and not able to go to the dining room to eat even meals with other residents, and, or even without even social distancing in place. So they've just been treated very differently than any other population. And I think it goes to needs to be explained too that nursing homes are the most heavily regulated industry next to nuclear power plants. And I just feel like they've been treated differently as a sector also. And I know that they've had a lot of challenges on their side too.
Yes. Well, I think the good news is that, CMS, the Center for Medicare and Medicaid Services, did decide, they listened, to the concerns being expressed by families, to the concerns of ombudsman. There was a federal commission that was appointed that looked into safety and quality issues, and they reported out in mid-September, a little bit before that. And one of the major issues that they looked at and that everybody had agreement on was the need for more visitation. So CMS did lift the restrictions and basically restore resident rights, which include the right to visitation or to refuse visitation on September 17th in a memo. They issued that memo. That's terrific. Of course, it's basically still up to the nursing home to decide, nursing homes across the country, 15,400 or so, to make that happen. And so one of the things that we would like to do is to ask the community, all of you out there who may hear this podcast or know people who live in nursing homes and have loved ones in them, to keep an eye out. Is the social isolation and the loneliness continuing? Because it really should not. And the CMS September 17th memo makes that clear, that outside visitation is desired, and weather permitting, that people should absolutely be able to see people outside and go outside. And that if the community spread, the sort of backdrop of community spread is below 5% or between 5 and 10%, that visitation, can be arranged with appropriate precautions inside the nursing home, with PPE, with masks, and with all the right requirements. So that will help. But social isolation and loneliness in nursing homes is also not a new phenomenon. It existed before COVID-19, and it may continue. So I believe that we ought to keep a close eye on it. I think that Ombudsman probably will. And families certainly should. Some of the recommendations that we include in our report are that the risk for social isolation and loneliness can be assessed, proactively in the care planning that nursing homes do. I don't think it is specifically assessed for, but it could be. You could, in fact, survey nursing home residents themselves and families and say, well, what would you like to see in the way of activities in nursing homes? Perhaps people really do enjoy bingo, or perhaps they'd actually like, something else. And what would
It's like it's so funny. I've always told people, it's like, when you end up in a nursing home, and some activity directors are really, really good, but I was like, basically, if you're in a Southern nursing home, it was like the Bible or bingo, like those were your two activities. And, so I think that has gotten better, but even my mom said, like, at least she gets to play bingo. And I'm like, well, that's probably the first time I've ever been thankful for bingo, but she had to sit in her doorway and listen. So if you've got an older adult with a hearing impairment, like, grandma just doesn't hear very well. So.
Right. Yes. I mean, activities are really as broad as the imagination. And one of the things that's occurred, not only because of COVID-19, obviously because of technology, is that you can find so many things online. It's remarkable. You can find the world's best orchestras. You can find theater. You can find book groups, and really anything. And so nursing homes are not known, for being as wired, as internet, friendly as perhaps they could be. And again, I think this has been kind of pointed out, by COVID-19. And at this point, CMS is encouraging nursing homes to apply for funding in order to provide residents with tablets, so that they can have them and use them if they don't already have a smartphone or their own, laptop or something like that, in order to keep them connected. I mean, there's nothing that is hard about doing that. It just needs to be organized. You can appoint somebody in nursing homes, or several people, who create visiting plans so that people actually know, when they're going to have visits from people when they go out. Perhaps they can go out into the community. When is that? There's nothing prohibiting creating schedules for that kind of thing. So the kind of devastation and, kind of keeping people in their rooms with the door closed, I hope that phase is over, and that we are moving into a phase where this is a phrase I really like, and the Canadian government uses it, distance socializing. Mm-hmm. And really what that means is that if you have the appropriate protections, PPE, masks, and so on, you don't have to decrease socialization at all. As a matter of fact, you can increase it. So I hope that becomes kind of the attitude of nursing homes and of people working in them and people living in them, that, as active as they want to be, that is entirely doable.
It is. And those would be good things to even continue after, the pandemic. I think the hardest part for families and residents with the social distancing piece of it is the lack of the ability to touch someone.
Yes.
And I know that's the, being able to give somebody a hug, things like that. So any recommendations for how to handle that? I mean, I know the report with CMS recommended essential care partners. And my thoughts were, well, if we can test college kids or the staff for, once a week, why couldn't we have a dedicated essential partner? Because it's not like the staff go home and they are quarantined. I mean, they're out in the community doing, they're living their regular lives just as an essential care partner would.
Yes, the presence of family and of treasured people in a nursing home resident's life is incredibly important. This is often the last several years of people's lives, the last 2 or 3 years perhaps. And so when you think about it from that perspective, a 6-month period where they didn't see these most important people or feel their touch or hear their voice right next to them is about as bad as it gets. And some of the comments that we got reflect that. I mean, here's one. I miss hugs and touch, especially from my family members. COVID-19 has limited my visits with my son. There is no hope. I have no cognitive impairments. However, there is the isolation, loneliness, and not seeing my spouse for over 100 days now. My spouse was usually here 2 times a day. So I think that we've all learned, that these most important people are really at the center of nursing home residents' lives. They are probably the most meaningful touchstone they have, and we need to make every single effort that we possibly can to allow those folks to be inside, to be outside, to be in touch with their elders.
Okay, so any other final thoughts? I mean, I think it's the work that you guys have done is incredibly important. I hope that people will take the time to read it and to realize that this, group of people deserve our attention and our advocacy to help them. So I mean, CMS can say you need to open up visitation based on guidelines, but then each state then dictates like what that's going to look like. And we're coming now into colder weather, and so even the outdoor visitation is what they had allowed in North Carolina, but they're going to have to move that indoors in some capacity.
Yes.
And so then you have individual facilities or individual corporations trying to figure out, so how do we actually execute this while maintaining safety? Do you know of, and I haven't heard of this, but is there like a place where, or maybe ACA and Leading Age are helping facilities like with best practices, like who's doing it well, so that people aren't just having to come up with ideas all by themselves?
Well, one of the things that we did in our report, and I do hope that people use it, for advocacy, use it for information, is that we include a lot of reports and resources. So there are a bunch of best practices, and I encourage people to check those out. I also encourage families to carefully monitor, their loved ones and make sure that they are, as the weather gets colder, as it gets maybe a little more challenging to visit people, to insist, that the access not be closed off again and not be denied. It's an ongoing issue. I think that the Ombudsman will be keeping a very close eye on this. And really, it's incumbent on all of us, I think, to do that. Nursing home staff themselves, I think, have become more sensitized to this. So I think they will probably be more helpful. I've heard stories, there are lots of good stories about nursing homes where they were short-staffed. And so they basically, helped each other out. And the administrator, did some circulating in the building and visiting of residents, and the director of nursing and the recreational therapists, and everybody kind of pitched in as needed, to be able to manage the workload, to be able to manage the cohorting that was necessary for people with COVID-19. So it is doable. I think that it's become fairly clear that both safety and quality of life are essential to the nursing home industry at this point. You can't just do one. You can't just help people remain safe and keep them closed off from the world and expect them to thrive. They will not. So putting an equal emphasis on both is I think, what's required for the nursing home industry to thrive and survive going forward. It is a tougher era. There's no doubt about it. occupancy rates in nursing homes are down, and that's not a surprise. People are leery of going to nursing homes. Of course, they're leery of going to hospitals as well. So in order to, keep the model viable and to improve it over time, I think that the kind of work that does emphasize quality of life, that does reduce the risk of social isolation and loneliness is going to be key to the future, really, of this entire industry, this entire sector.
Yeah, and I think that another good thing that's going to come out of this is the National Academy of Medicine is just announced their first patient safety and quality report. They're going to do the second one because the last time it was done was 1987.
That's right. Yes.
But out of that came, OBRA and the regulations for skilled nursing homes, whether, that's good or bad. I mean, they're certainly better. But hopefully that work too will make a difference and bring, this report certainly could inform their work as well.
Yes, I'm excited about that, actually.
Me too.
That National Academy study was seminal, as you just said, in creating the conditions really for a big nursing home reform act that was rolled into the budget bill of that year. And actually, when I was privileged to work on Capitol Hill for the Senate Special Committee on Aging, it was the 20th anniversary in 2007 of OBRA 87. And we looked at the accomplishments of that law and the challenges still remaining. And we built on that structure, to improve things. And we did pay attention to quality of life in nursing homes. And we actually called for, and it's authorized, a comprehensive culture change demonstration in nursing homes. And that hasn't yet happened, but it is one of those things that CMS and the Center for Medicare and Medicaid Innovation could pick up and figure out how to do and incorporate all of this research on culture change and make it the norm. So that remains ahead. I think that there is a great deal that consensus study will probably look at, and I look forward to seeing what they come up with.
Yeah, me too. I can remember my first job out of nursing school, they just handed me what was then called the pink book. That was like my job was, I was like, what is this? So I don't know that they still call it the pink book, but a lot of different things to keep in mind. But I definitely think that culture change is the way to go. And I think there are a lot of people on that NAM committee that will help. And I know that will be seeing the work that you guys have done too.
Absolutely. And Congress is paying attention again to nursing homes. That's also a very good sign. Congress often doesn't pay a lot of attention to nursing homes, but now, with the difficulties and the challenges and also the opportunities, I think there is quite a bit of room, for further legislating, further improvements. So I'm looking forward to seeing what comes up.
Yeah, and the other side of that too is, the other group that's been left out in the dark are people that are in assisted living. So it's really anybody that's living in kind of an institutional, organizational type of setting. And, on some level, being in a skilled nursing facility at least meant you got some direction from CMS. And then the families with people in assisted living were like, but CMS just said that. And it's like, but CMS doesn't regulate assisted living facilities or group homes or any other place. So I think helping people understand the difference in long-term care settings and also beginning to reimagine long-term care, what it needs to look like in this country. So
absolutely. Well, I hope you do some more podcasts on that.
I will be.
There's a lot to say on what we could do on long-term care.
Yeah. Well, thank you for everything that you had to say today and for joining me. And we'll certainly be sure to link all of the different reports and different resources that you guys have included.
Well, thanks so much. I really appreciate the opportunity.
All right. Thank you.
Thank you for joining me today for This Is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.